myself Dr. Girija, consultant neonatologist and pediatrician, Vamshodaya Hospital, Kolar. I'm going to talk today about first 100 days after birth. So this is an interesting topic because you'll have a lot of concerns and queries over the first 100 days after birth. So you have welcomed your little bundle of joy. Now you have to take care of it all along. So there will be concerns about feeding, how to soothe a crying baby, about your nappies, about the reflex, that is GERD, and infantile colic. So coming to feeding. So breastfeeding babies actually feed for every 2 to 3 hourly, that is breast milk gets digested quite easier and makes the baby quite hungrier. Whereas a bottle fed baby takes around 3 to 4 times, like every hourly feed. So on average a baby feeds for almost between 8 to 12 times in a 24-hour duration. So coming to the nappies, like newborn babies, stool will be usually dark in color, that is because of the meconium which the baby was consuming in utero, and the stool consistency and the color will change gradually. So the stool will be yellowish and liquid in color in case of breastfed babies, whereas in case of bottle-fed babies it will be greenish in color. So the number of wet nappies are also important to know whether the kidneys are functioning normally or not. So around 6 to 8 wet nappies will tell that the kidneys are functioning normally and the breast milk is adequate. So coming to soothing techniques, there are a lot of reasons to know that why a baby is crying. It might be just because of hunger, or it might be because of a wet nappies, or maybe the baby just wants to be held. So a newborn baby has many reasons to cry. Generally, it might be even overstimulated also. It just needs a change in the environment. So if you held the baby, if you keep the baby close to you, or if you swaddle the baby, that will soothe the baby. So coming to sleep, when you welcome a new baby, you welcome even a sleepless night. So there are a lot of sleepless nights for the parents. So how to know whether the sleep is adequate or not? So babies, on average, newborn babies will sleep around 16 hours a day. So a night sleep or even a broken sleep might be disturbed for the parents. So how to make a sutana baby, how to make the baby sleep? So one way is like sleep with the baby, like next to the crib, or else keep the baby in a swaddle. So you will prevent the startle reflex in them. And next is take rest, like sleep when the baby is sleeping. And the most important is there is lot of emphasis for the tummy time. So what actually is a tummy time? It's like keeping the baby on a prone position, that is on the tummy, either on a blanket or on the mother's chest or the father's chest for quite few minutes, a few times in a day. So how does it help? It helps for the development milestones for the babies to be achieved. There's a lot more emphasis on the colic reflex, on the GERD in the babies. Like yes, a bottle-fed babies will have a lot of infantile colic because it will formula feed will take a lot of time to get digested. So reflex and colic do exist. Take the help from the doctors, birth the baby adequately. This helps to relieve the colic and GERD in babies. So support. A lot of emphasis on all. We'll worry about whether my child is feeding or not. We'll worry about plenty of things. But when it comes to support, yes, a woman needs an emotional, physical and mental support during rearing a child. So they'll have a lot of emotional blues, there's a lot of postpartum depression in a mother because of a lot of sleepless nights, not able to handle the baby adequately. So when you need, you take a support from your family, friends. So you have welcomed a bundle of joy, take care of it.